We're also now looking at the high risk of internal transmission. That risk had not reached us, but we believe now it will be setting in. That's the reason why we have to actually work very hard, because the problem of our inequality of our society means that there's one area where at the moment the people who have been found to have the infection are those with the means, resources to visit Italy, Switzerland, Canada, US. But advantage of those is that you can get them back, you can quarantine them in their homes. Once this infection begins to spread in the taxis, in the trains, in the informal settlements, it's going to create a new dynamic. That will mean that we need to create quarantine facilities. So we have told the MECs to start looking at possibilities of creating facilities for quarantine if necessary. And you will understand as well that when we say quarantine, it means someone might have to move from their homes. So when we talk about how we progress in the next 2 to 3 weeks, we will be we'll be looking at how all of these are panning out. And therefore, at a certain point, we will be able to make the necessary calls as to whether the current measures are enough to contain the infection. But what we are saying to all South Africans is that, led by the President and the Cabinet, we need to form a united force behind government and all the leadership in our country, because at the end of the day, this outbreak can only be defeated at the level of our community.